All right, I think there's a few more people who are expected to jump on, but we'll let them enter the room as they are ready. But for the sake of time, we'll go ahead and we'll just get started for today. So I just want to say thank you for being here today. So this is an advocacy, part of our advocacy series for the Margaret Hackett Family Program. So for the Margaret Hackett Family Program, for those of you who don't know what it is, we are dedicated to helping families and patients with congenital anomalies in the central nervous system. So we have various components through our program, I guess, that are in development right now. So currently right now we are doing some lab research, we've got some clinical research, and then we've got some advocacy that are going on and as our part of our organization that are all just dedicated to helping, like I said, patients and families. Our hope is someday to find better treatments for these patients, but in the meantime, to really equip them with advocacy materials as well and just information. So that's why we are holding this event today, is to just equip you all with information about IEPs and 504s. We know 504 plans. We know this is something that a lot of patients and families have requested. This is something that they have asked for. So we just wanted to equip you with this information on your journey. And in a few minutes, I'll put up my information. I am Julie Dressler. I am the program manager for the Margaret Hackett Family Program. So feel free after this presentation to reach out to me with any questions. And I will also put up our website. So if you want to know more about the various resources and the projects that we've got going on at the Margaret Hackett Family Program, I would be more than happy to share those with you. But we've also got with us today Margaret Hackett, who is the reason that the Margaret Hackett Program exists. Margaret has had just such a crazy journey, and one that is very inspiring through all of the, I guess, challenges that she's faced with some of her congenital anomalies as well. She's got just a unique story, very inspiring story. So I just wanted to give her a few minutes to share with you today before we kick off our presentation. So I'll turn it over to you, Margaret.
Okay, thank you, Julie. Yes, so I don't do as well with speaking as obviously you do. So I did have to write it all down. So I don't do extemporaneous. I don't speak extemporaneous. You know what? Yeah, I don't just speak off the cuff of my hand. Anyway, so I'm here on behalf of the Margaret Hackett Family Center, a nonprofit organization. My family and I, in conjunction with the University of Chicago, we set up to help those families who find themselves in the position that we did after my diagnosis of a congenital anomaly. I was born with a rare bone disease, which led to, among other things, a diagnosis of hydrocephalus, Chiari-1 malformation, and syringomyelia. So my parents were blindsided, obviously, with this devastating news, and struggled with the lack of resources, lack of knowledge, lack of research, and really didn't really know where to go, or, we're totally unprepared for this event, or, for this to happen. So we felt hopeless, not knowing who to turn to, where to go for help. And then for 5 years, we struggled to find help. Struggled to find a doctor who could handle my complex case before we found the doctors at University of Chicago. So once I finally reached a place of stability and I could kind of actually breathe a little bit, an idea that I'd had several years ago in the midst of all this was, I wish there was an organization, I wish there was something out there where people could go to find help, to find support, to find the resources they need. And So for that idea led to, it actually kind of came, to reality when we were able to do that after I kind of got better. And so that's really what we want to do. We want to be able to just help people. And for, like this call is about IEPs, 504 plans, because this is something that you won't get from your doctor. Your doctor is not going to be able to prepare you for what you're going to face once you go home. So things like, insurance issues and, 504 plans, anything about adjusting to life with your congenital anomalies. So I just hope that people can get something out of these talks, and that's really what we're all about.
Thank you for sharing, Margaret. You have such a great story. That's great. No, you did a great job. Thank you so much for just sharing your story and just, really, like I said, inspiring me and inspiring other people to really advocate to find the information that they need and to just know that they are not alone. And that's really what this organization is about. And at the Margaret Hackett Family Program, we also want to connect with various organizations out there to really equip, people in need with various amounts of information. So we are, a hub at the University of Chicago, but we also have other organizations that we connect with as well, who can give even more specific information into these conditions. So we have Amanda Garzin, who is here from the Hydrocephalus Association. So I just wanted to give Amanda a minute to say hello. So I believe, Amanda, if you raise your hand, we can give you the capability to speak and introduce yourself real quick. Okay. Are you able, Rosa, to grant? There you go.
She's muted.
I am in. Hi, everyone. It's so wonderful to be here. Thank you so much, Julie and Rosa. I am the COO of the Hydrocephalus Association. The association was founded in 1983 by a group of parents who were desperate for information about the condition and for fellowship with other parents and for their children as they moved along their journey. As many of you might know, hydrocephalus actually impacts everyone from childhood, infancy, all the way through adults. So the organization actually provides services for infants and parents all the way through seniors in the United States of America who develop a form of hydrocephalus called normal pressure hydrocephalus. And we have a number of resources to help you along with your journey. Please don't hesitate to reach out with us. It's so wonderful to be partnered with the foundation and to be here for all of you as we all journey together through these complex medical conditions. My daughter also has hydrocephalus, so I am one with you in the journey. Julie, is there anything else you'd like me to say?
No, that's great. So thank you for that. And we will, like I said, we'll post all the information from these different organizations as well. So those of you that are joining the call, if you have questions, you can reach out to us, but you also have other organizations that you can reach out to as well. So that's great. Thank you.
Yes.
And next we've got Heather from Concord Chiari. So Heather, I'll go ahead and let you introduce yourself. So if you raise your hand for a moment, we can grant you access.
Okay, can you hear me?
Yes, we can hear you.
All right. Well, I'm Heather from Concord Chiari, and I'm kind of the one who does all the events and the go-to person. If you have any questions or trying to connect with people in your area, I'm happy to get you connected. And Concord Chiari has been around for quite some time as well, and we are dedicated to improving the experiences and outcomes of Chiari and syringomyelia patients. We have a lot of resources for you guys, also very specific to taking Chiari to school or getting a primer for nurses to help you with a health plan and things like that. So we're so happy to be here and partnered with all these great organizations just to get out to these patients. And if you need anything, feel free to reach out to us specifically as well.
All right. Thank you, Heather. And then we've also got Matt from the Illinois Spina Bifida Association.
Hello, and thank you, Julie. And thank you, Margaret Hackett and the team at the Margaret Hackett Family Program. I'm Matt Larson. I'm the Executive Director of the Illinois Spina Bifida Association, and we serve people throughout Illinois, anyone living with spina bifida. There's no membership requirements, and most of our programs are free. If you are looking to get information or connect with other families, if you're looking for financial assistance, or if you're looking for one-on-one coaching about any sort of medical, insurance, education, or job, or other goals that you were working on, we are here to help. And we're just delighted to be working together with Margaret Hackett Family Program and in conjunction with today with Concord Chiari and the Hydrocephalus Association. So thank you, everybody.
And thank you so much for Amanda, Heather, and Matt for being here. That's one thing we really, try to do is collaborate here at the Margaret Hackett Family Program. We realize that the needs, of all of our patients and families go beyond us. So we really want to bring together people from the Chicagoland area, but actually all over the United States to really just bring together, like I said, our resources and the best people out there to really provide, everything possible for our patients and families. So thank you for being here. And with that being said, I will turn it over to Sandra Taylor, who is a social worker here at Comer Children's Hospital at the University of Chicago. The great thing about Sandra is she is a social worker here at Comer, but also was a social worker in the Chicago Public School District as well. So she really is a resource when it comes to navigating these processes in the hospital, but also navigating these processes in the school system. So I will turn it over to you, Sandra.
Okay. Hi, everyone. As she said, I'm Sandra Taylor. I am the neurosurgery social worker here at Comer. So I help a lot of our families in navigating issues in the hospital as well as in the community and in school. And so I'm here to help all the parents who might need access to Ronald McDonald House while you're inpatient at the hospital, or you have insurance questions or school questions. I also reach out to the schools on you all's behalf if you need me to. So I'm kind of just a catch-all for issues in the hospital, at home. If you need financial assistance, I'm here to kind of support you all and give you resources in the hospital. So I'm gonna share my screen. Can you all see? Okay, there we go. Can you all see my screen?
We can see it.
Okay, perfect. So the presentation today is about navigating 504 plans and IEPs, a guide for parents with children in Chicago public schools. And then also this applies to any Illinois school, really. So these are state mandated programs of 504 plans and IEP. So any Illinois school it applies to, but I've worked specifically in the Chicago public schools. Okay, so first, what is a 504 plan? A 504 plan is appropriate when a child's special health care needs are significant enough to impact the child's daily activities in the school environment. So typically, if they're having a chronic health condition, such as a neurological condition that we've been talking about, likely it's going to affect them during the school day. So they're going to need special accommodations during the school day to help them be successful at receiving their education. So a 504 plan is usually a plan made with the nurse and the teachers at the school to make sure that the child gets what they need during the school day, whether it be medication or breaks during the day or water bottle in the classroom. We kind of create a plan on paper that's that the school is going to provide those services to your child. So you want to ask the nurse specifically about the 504 plan and whether your child is eligible or not. Okay, so an IEP plan is a little different because it is a document that outlines the special education and related services that your school district will provide for your child at no cost to you. So some of those related services are occupational therapy, physical therapy, speech, counseling services, and the school district will pay for your child to have those services during the school day. And then the special education program is a plan that the teachers make to modify the child's education and make sure that they're able to, the education is at their level of the child after they're evaluated. So there's a full IEP, which is a document, it's a contract between the parents and the school district stating what the school will provide. It is developed for children who have been evaluated and are in need of special education. So there is an evaluation process that your child will go through, and then you all will have a meeting together with the school staff to make decisions on what your child needs in the school. So, like I said, meeting. So initially you'll have a meeting with the case manager. Each CPS school definitely has a case manager. And so you will let the case manager or the vice principal or the principal know that you're interested in having an IEP or a 504 evaluation. So if the student qualifies for special education, then you will have an annual meeting every year to review the accommodations and services that the school has agreed to provide. So you will talk about whether they've been providing them adequately, whether the child still needs those services or not, and what the child will need going forward. You have a right to participate in all the school meetings for IEP meetings and 504 plan meetings, and discuss what you think your child needs, whether you agree with the teachers or not, whether you agree with the evaluation or not. And I encourage you to just be an active participant in that conversation. The purpose of the meeting is to discuss, develop, and revise the document. As I just stated, the school is responsible for coordinating the meeting. Usually in the meeting, there is the case manager, the parents, the school psychologist, the social worker, the nurse, and also the teacher, any teachers that'll be working with the child, and a special ed teacher. So it's usually a primary teacher and a special ed teacher. And the IEP meeting, like I said, happens every year, but the initial meeting, there's usually like there's 60 days where it has to occur within that 60 days. So there's some time that happens between the initial meeting where you're requesting it, and then the second meeting where you actually create the goals and plans for the child. And then you also have your annual meeting every year once there's an IEP in place if the child qualifies. Okay, so how to request a 504 plan or an IEP. You contact your school. For a 504 plan specifically, you contact the nurse, because the nurse is the one who creates the 504 plan because it is health related only. The IEP plan, usually contact your school counselor, case manager, or principal, or you can even contact the social worker if they have one at the school. Every school does not have its own nurse or social worker. Usually they share amongst schools and CPS. But some of our suburban schools or private schools, they may have a specific nurse at their school. So you always need to contact an administrator. I highly suggest that first if you can't contact the nurse, because she might not be in that building on that day that you're visiting. But they all have a nurse assigned. They all have a social worker, a case manager, a principal, vice principal at each school. The teacher is usually not the person to coordinate these meetings. So please don't ask the teacher for IEP or a 504 plan. You need to contact your administrator or the nurse for either of these. You want to tell them about your child's impairment as soon as possible, as soon as school is open or before school is open, because usually the teachers are there a week before school starts, so you're able to call the school and let them know that you're interested in a IEP or a 504 plan. But I also highly, highly suggest that you put it in writing, that you write a letter and you either hand give it to the principal or vice principal, or you can even email or fax it to the school, because when it's in writing, they have to do something about it. So I highly suggest writing a letter, and if you need help with that letter, you can let me know and I can help write the letter, and I can also have your doctor provide a statement for you guys. And then I also suggest that you bring any medical documents with you, because they will request that. And there are forms as well on the CPS website. Usually you have to fill out healthcare forms every year for your child when they start school. When they have their physical, you have to submit their physical information and like a medical statement from your doctor saying that the child has a certain condition. So it's good to attach those documents to the letter that you're providing to the school. Okay, so some of the tips that I suggest, like I said, make your request in writing and submit it to the case manager or the administrator, and for a 504 plan only, just to the nurse. When you're having the IEP meeting, make sure that you understand what you're signing and ask as many questions as possible in the meeting. And please don't sign anything that you don't agree with. Like if you don't think your child needs, 30 minutes to go to the bathroom during each class, which is kind of excessive, then you shouldn't sign off on that. You might say, oh, my child only needs 10 or 15 minutes. But if they do need 30 minutes, if the bathroom is on the first floor and they, need to get to the fourth floor in a different building, they might need more time. So just advocate for your child and state what you really think they need or not in the meeting. The IEP assessment must be completed within 60 days of the request. That is the Illinois state law that it must happen. So if they don't conduct it in that time, you can take legal action if they don't do that. Now, that is 60 school days. That is not 60 regular days or summer days. Summer does not count. Spring break, Christmas break, those are actual school days that they count for 60 days of the request being completed, the assessment being completed. You're allowed, like I said, to give your opinions and make requests. So whatever you think your child needs, make those accommodations. The biggest thing is to remember an IEP is more of an education plan, and a 504 plan is the healthcare plan. So you can't make requests for learning accommodations, such as he needs 20 minutes of extra reading each day in a 504 plan, because that's not related to his health. So, but you might say he needs extra time on exams that is related to his health if it's like neurologically related. So it can be a little confusing, but the IEP is basically based off of their learning capabilities, and a 504 is based off of their health condition. Hopefully that's clear to y'all. And then accommodations examples, I made another slide for that. So like I said, modified learning. So being taken out for special education time, extra, like changing what the child is learning and how many assignments and how many tests they take. So those major changes are only in an IEP versus like they're still taking the same test, but my child might need a little bit longer than the other students because they have a neurological, condition. So that can be included in a 504 or IEP. Or if they need to make up assignments that they missed because they had appointments or they were in the hospital or they just weren't feeling well a couple of days, you can get those extensions included in a 504 or an IEP. They may need a water bottle during the day, or bathroom visits, elevator access, nurse visits. Those are all things that can be included in a 504 plan. And the IEP and the 504 plan can be combined as well, but there are things that are specific to the 504 plan. Like if your child broke his arm for one week, they would only need a 504 plan because maybe they need their sling, maybe they need special accommodations in the classroom for a certain type of desk. So those are things that will only be in 504 plan. Hopefully I'm not confusing you guys. But there, if you have an IEP, you can also include the health conditions as well, if they feel like your child has a learning disorder. Okay, and then occupational therapy is a part of an IEP, speech services, social work minutes, and those are parts of an IEP. Now, if your child needs to take medication during the school day, then they will need a 504 plan, and they will also need a letter or a document signed. If it's over-the-counter medication, usually the staff in the office would give it to the patient if the parent approves. But if it is a prescription medication, they will need a letter from the doctor in order to give it at the school. But usually the children cannot carry their medication around during the school day unless they have like seizures or something like that, or like an allergy or something like that. Then sometimes they can carry their EpiPen, but even then they still need a letter from the doctor. So for more information, because I don't work for CPS anymore, it's been a while, you can refer to cps.edu, and they have the medical forms available on that website. And then they also have a whole page for chronic conditions that you can visit and see. I have to open that for you guys. And it kind of lists some of the chronic conditions that they frequently
Can't see that, Sandra, sorry.
You can't see it?
No,
Oh man, okay. Let me see if I can
I
share.
think you have to share your screen in order for us to
There we
see it.
go. Okay, can you see it now?
Yep.
Can you see it now, Rosa?
Yeah.
Okay, sorry about that. Okay, so this is the CPS services and supports website where you can see their chronic conditions, and they have some of the most frequent ones like asthma, diabetes, allergies, and a few videos on there as well, and how they deal with certain things. And then we have the forms available for you all here, which is at cps.edu medical forms, where you can go on there and find out all the forms you need to complete to give to the school. But there's no IEP or 504 request form. You do have to write a letter or get a letter from your doctor to request it. And or the social worker, I can write a letter for you all as well.
Mom lives away from dad.
And this is the student health and wellness hotline where you can call to ask questions as well, or you can send an email to this website to ask questions about IEPs and 504 plans, or if you're having issues with the school not cooperating, you can email this link here. You can also contact me to help with these services, helping them.
I want to make sure.
Sorry, my coworkers talking, but to get these set up as well, you can contact me here at Comer. Are there any questions? They say you have to raise your hand to ask the question, I believe.
Yeah, thank you, Sandra. That was a really great presentation and a lot of just really informative information on how to navigate the process. I know it's not always a process that's intuitive and there's a lot of steps. So thank you for just taking the time to clarify that. And we'll also, Sandra, are you able to send the presentation to us? Because we can send it out to everyone.
Yeah, I can send it to you.
Thank you. So we'll make sure to follow up with the presentation and additional information. We also have recorded this presentation, so we'll be able to put this up on our website if you have any questions to go back and view the information. But yeah, as Sandra said, if you have any questions, feel free to raise your hand and we will enable you to ask the question, or go ahead and drop it in the chat. So as people are gathering their thoughts for their questions, I just have a few things, Sandra, that I guess I'm kind of wondering myself. So one of the things is, if there needs to be a change to a 504 or an IEP plan, how do we navigate that process? So for example, if something changes in a patient's diagnosis, how do they, I guess, make more adaptations to the 504 plan?
Okay, so typically for a 504 plan, you would just contact the nurse at the school and she can make accommodations for the 504 plan. For IEP, you have to wait till the annual meeting to make accommodations for
That's the
IEP.
way I was reading it. I just didn't know if that was like, I was like, am I being like?
Okay, good to know. One other question that I have is, are there 504 plans or IEPs available in college? So I imagine that this process is a little bit different once a student graduates high school. So if a student wants to pursue additional education, but may need some accommodations, is that available in the higher education process?
Cool, thank you so
Yes,
much.
there are accommodations available in college or at a university. There's usually a nurse on staff who helps to make those accommodations for the students as well. But they're not called IEP or 504 in college setting. But it's the same way we submit a letter usually to the university nurse, letting them know about the patient's condition, and then letting them know what kind of accommodations we suggest for the patient as well.
Okay,
It
perfect.
looks like Heather actually has a question. Heather, I'm going to allow you to talk.
Hi, Heather.
It's Heather from Concord Chiari again. I just had a quick question. Do you know how universal these are based, between different states? Like I know I'm in Minnesota. Are they pretty similar, or is it very different state-specific laws?
It's pretty similar across states. Now, the days that they have to make the accommodations might be different, and the names of it might be different. Like it might not be called IEP or 504. And I don't know if I said IEP stands for Individual Education Plan. That should have been the first thing I said. Okay. But I think the names might be different in some states, but it's the same overall request for
General
accommodation.
rules that way. Okay, thank you
Yeah.
so much.
So if my knowledge serves me correctly, Sandra, so when it comes to providing accommodations in the school district, this is something that is a federal law, correct? So every school that gets state funding has to provide accommodations, correct? So it's different in the private schools versus
So
publicly funded schools.
It's actually a state law.
Oh, okay.
So it's throughout the state, whether it's private or a public school. The thing is for private schools, the public school district will have to provide this. The private school might not have they will have a nurse, but they might not have an occupational therapist at their school. So the school district will have to supply an occupational therapist to go to that school to fulfill that service. Does that make sense?
Yes, that
Okay.
makes sense.
Start video. All right, sorry, I'm finally back.
Hey, Margaret.
There we go.
Yeah.
Sorry, Julie, didn't mean to leave you by yourself out there.
That's okay, no problem. We were just wrapping up the presentation and going over questions. Do you have any questions, Margaret, for Sandra?
Well, I did just want to say, Sandra, that was an awesome presentation, and
Thank you.
probably a couple years too late for me.
Okay.
I know when I was in high school, and I was really, I was diagnosed with syringomyelia when I was 17 years old, but I had hydrocephalus and Chiari diagnosed when I was 12. So literally it was just in that, high school, all that period. And, it's not like you would ever know about this unless you have a reason to know about it. And so, once, I'm thrown into that situation, we were more concerned with surgeries and all that part. And then it was like, I come back home and there's that whole aspect, because had I not, been put on the 504 plan, there is absolutely no way I would have been able to graduate high school in the 4 years. Because with the 504 plan, I was, they provided me, private tutoring. I was able to get adjusted schedules. They would drive me to a class that was off campus, like it was just across the street, but for safety. So again, I mean, I think that, yeah, it's so good to have that information available because, when the time comes, you don't have much time to look. So anyway, very good job. Thank you. I want to thank you
Awesome.
for your job.
Thank you for that. You're the perfect example to show people that it actually works.
Right. Yeah. So, I mean, I was lucky that I was at a high school that I had a really good school guidance counselor. And she literally brought us the paperwork. She showed us what I needed. I mean, I almost was like, Mom, do you know what we're signing? Do you know what we're doing right now? But yeah, she was, she recognized that, I wasn't in need of something as, not severe, but as encompassing as an IEP, because that is a much bigger step to take. So she, recognized and found a way to make it. I mean, she did everything. And I look back and I'm like, thank goodness we had, yeah. So, yeah, I think this is very good information. And I mean, I know that Julie was telling me that she would be talking to the, Judy. You were talking to Judy, and she was, Dr. Frim's nurse practitioner, and people would come to her and ask her about, certain questions about like 504 plans, or, ask things about, something that, they're medical people, they know the medical side of things, but then after you leave the hospital, there's a whole world of adjustments. And there, I'm done talking.
You're so right, though.
Yes, turn my mic off.
No, you're great, Margaret, and we just really appreciate you sharing your story, being so vulnerable, and just, providing real life examples of how you've had to navigate, the process of the school system and the 504 plans, the IEP plans, and also, the life changes that you've had to make. Like you said, it goes much more beyond the medical diagnosis. You receive the medical diagnosis, but then that's really the start of navigating the just life-altering process, of coping with the condition and all the things that come along with it. So thank you for just being a light, Margaret.
Sorry, one thing I just realized, another thing that a 504 plan was able to help me with was taking my ACT and SATs. And so they're like, at that time, I needed to lay down. So they gave me extended time to allow me to lay down and be comfortable, and so I wouldn't have to rush through it. And because it hurt to have my head down, take the test. But that's all I'm saying. It's just, it was able to help me with that and test taking. And so, yeah, yeah, there you go.
Oh, this is great. So if there are no more questions, then this concludes our presentation for today. So like I said, this will be up on our website, and then we'll follow up with additional resources to everyone who attended today's presentation. So thank you, Margaret, for being here today. Thank you, Sandra, for the wonderful presentation. And thank you, Amanda, Heather, and Matt for being here as well, just to be a resource for any other needs that, families and patients may have. So together, hopefully we can, just provide resources and get everybody the help they need, and yeah, bring everything together. So we'll be providing more information on the next event to come, which will probably be in November. So be on the lookout for everyone attending that, and then we'll keep everybody in the loop. So have a good afternoon, everyone.
Bye.
Bye. Thank you for having me.